The question of what is single payer, it's a hard term for a lot of people to understand because they keep hearing all these other things like public option and private insurance and so on. Single payer systems occur all throughout the world. And what it is it's a system where the payment for all health services, all the funds that go into healthcare, that includes your private insurance, premiums, Medicare, Medicaid, veterans, all the money that gets spent on health services goes into a single public agency that then pays all the medical services that are provided by providers, hospitals, doctors, everything else, so that basically it's publicly funded, but it's privately delivered.
Barbara, is it more money or is it the same money? But some people say, oh, we can't do that because government will kill the government. It's going to cost too much.
Well, it should cost less money because as much as 30% of your healthcare premium now goes to pay for administration and for profits. It costs on the order of $65,000 per primary care physician to deal with the insurance companies.
In the United States, we make an average of 4 visits per year per person to see the doctor. Japan, which has a completely covered healthcare program, they make 13 visits per year per person to the doctor. And in Japan, as it turns out, they live, on average, 4.5 years longer than we do. They have a longer life expectancy. They don't have death panels killing off seniors, as so many people have suggested would happen with a single-payer system.
Most of these countries that have developed successful programs have an electronic medical record system. In Germany, they call it the Gesundheit card. In France, they call it the green card, pretty colored. In Taiwan, they call it the smart card. You go into the doctor, give your card, puts it in the machine, gets a complete readout of all of your health problems, all of your past treatments, all of your medications, gets all of sees what other doctors have done for you. But also, not only does it prevent doctors from abusing patients by over-treating, but it also prevents patients from abusing the system.
Our country is spending very close to $7,000 per year for every man, woman, and child in the United States for health care. The next closest country is spending, which I think is Canada, might be France or Canada, is spending $3,600 per year for every man, woman, and child. For the $7,000, we get 47 million people with no health insurance. Twice as much money for half as much care means 4 times as much money wasted going to the insurance industry.
So single payer is actually the fiscally responsible thing to do. All right? So this is about saving money immediately by getting rid of servicing the insurance industry and using that money to cover everybody.
Currently, there are 3,300 lobbyists in Washington who are opposing healthcare reform. That's 6 lobbyists for every senator and representative. The current expenditures are approximately $1.4 million a day. Now, I did a little math. There are 22,000 people who die every year because of lack of health insurance. If you divide the number of people who die into the year, that's about 60 who die every day. Given the fact that's $1.4 million a day that's being spent, if you kind of divide that out, it means that for each person who dies uninsured, that lobbying money could have bought 5 years' worth of health premiums for insurance, even in a lousy health system, for them, and possibly prevented those deaths. I think it's a travesty.
And then I'm going to ask you guys, we're going to ask you what you think the benefits of single payer are in just quick one-liners. Throws the money changers out of the healthcare system. Somebody else?
It takes the $153 million that the insurance company lobbied last year and the $236 million that the pharmaceutical lobbied last year and puts it towards health care.
That's our money. Who's going to be running the single payer? All right? We didn't really get to that question. It's going to be public health people. There's a concept. public health people in charge of the healthcare system instead of CEOs of insurance companies. And I believe that the litmus test for every decision that gets made is, does this decision mean that people get more health and less suffering for the money we're spending on healthcare? That's the litmus test. So that's right. Anybody else?
Yeah, to use a Catholic workers slogan, healthcare profits make us sick.
Healthcare profits make us sick.
I think it's a more democratic system, and we're a democracy, and we want to take our democracy back.
It's supposed to be a democracy, and we want to take our democracy back.
I'm a veteran. I got VA health care. Everybody in, nobody out.
I have a t-shirt out in the car. On the back of the t-shirt is a quote from Martin Luther King. He said that healthcare inequality is the greatest injustice of all. Our responsibility as a society is to recognize that healthcare is a right. If healthcare is a right, it's everybody in and nobody out. Whether they use that system or not, we cannot force people, we cannot know what they'll do. But if we don't provide the opportunity to everyone to have health, I remember growing up and the older generation saying that health was the most important thing in your life.